How do you choose among all the diets available to choose the best diet for diabetes, whether it's type 2 or type 1? And by the way, these comments are confined to adults because there's some additional issues in children, children with type 1 diabetes. So let's just talk about type 2 in adults and type 1 diabetes in adults. Well, I think there are essential ingredients, the ingredients I look for in choosing what diet might be ideal for a person with diabetes. First of all, it should achieve weight loss if weight loss is necessary. So if this is much more of a problem in people with type 2 diabetes who have often a lot of weight to lose, well, the right diet should allow you to lose that weight without additional efforts. That is, without extreme exercise, without having to add intermittent fasting. Just by going on the diet, that alone should achieve spectacular weight loss. Another requirement is that the right diet, the ideal diet for someone with diabetes, should allow substantial reductions in blood sugar. I don't know if you know this, but the American Diabetes Association diet is crafted to raise blood sugar to give you more leeway to give yourself insulin and diabetes drugs. Well, I don't accept that. I say, what is the diet that allows you to magnificently reduce blood sugar? In fact, this is so effective by choosing the right diet that you have to cut insulin by 50% or get rid of drugs like glimepiride, glipizide, and glyburide even before you start the program, because you're going to anticipate marked drops in blood sugar and you do not want hypoglycemia or low blood sugars when you start the program. So we cut those things even before you start the program so that you have a cushion of safety so you don't get hypoglycemic. But the ideal diet should help you reduce blood sugars. The ideal diet in a person with diabetes should also result in marked improvements in various metabolic markers. So triglycerides should go way down. Small LDL particles that cause heart disease should plummet. Fatty liver, a high AST/ALT, typically on a liver panel, should drop or normalize. Insulin resistance should drop. C-reactive protein should drop. So we should see an across-the-board marked improvement in all the metabolic markers that are typically associated with diabetes and partly responsible for all the nasty complications of diabetes. We want to see all those, entire landscape of metabolic markers. We want to see them improve or become ideal. We don't want to have to limit calories. Limiting calories is a loser's game. Two bad things happen when you try to limit calories. One, you're hungry, but beyond that, you have put yourself at risk for developing gallstones. That's because when you're not consuming calories, or you have a marked reduction in intake, you're not keeping your gallbladder busy spitting out bile. And that bile becomes concentrated, it becomes crystallized, and that's the process that leads to gallstones. We now know, because there have been several serial ultrasound studies in which people on various diets have had their gallbladders visualized with ultrasound, and many people develop gallstones within 4 weeks of cutting calories. Many more, often 50 to 60% of people, will develop gallstones by 3 months. So cutting calories is a marked cause for gallstones. Cutting calories for more than a little while also reduces your metabolic rate. And what that means is even if you maintain a reduced calorie intake, you will regain the weight, because your body's not burning calories. You fooled your body into thinking you're starving, so it turned down its metabolic rate for survival. So the ideal diet for someone with type 2 diabetes or type 1 diabetes should not involve cutting calories for those two big reasons. And lastly, the ideal diet in someone with diabetes should not worsen risk for cardiovascular disease, right? So unfortunately, so many of my colleagues have been fooled by the fact that fats like saturated fat, total fat, raise LDL cholesterol. Well, who cares? LDL cholesterol does not cause heart disease. That is a fiction that's been sticking around for 50 years because Big Pharma has made a lot of money through their statin drugs and other drugs to reduce LDL cholesterol. This calculated value that has almost no bearing in reality, that is a lousy marker, that hardly predicts heart disease at all. There are far superior markers. You'll find this conversation talked about elsewhere in many of my videos, in my Wheat Belly blog, Undoctored blog, my Wheat Belly books, Undoctored books. But there are far better ways to identify cardiovascular risk. So the ideal diet in someone with diabetes should get rid of excess triglycerides and the VLDL particles that they occur in. It should get rid of or minimize small LDL particles, the kind that are prone to oxidation, the kind that stick to artery walls and initiate inflammation. The ideal diet for a diabetic should reverse insulin resistance because that drives coronary disease and heart disease. So the diet should achieve a dramatic reduction in cardiovascular risk. So let's take some of the popular diets and see how they stack up by these kinds of requirements. How about a low-fat diet? What is Well, first of all, low-fat diet, you can lose some weight, but there's a honeymoon period. You lose some initial weight and then it tends to plateau typically. And you'll find that other forms of diets achieve much more weight loss. So a low-fat diet, as advocated by many agencies, cut your fat, cut your saturated fat, eat more healthy whole grains, all that sort of thing, can achieve initial weight loss, typically 10 pounds, but then you plateau. So if you have 70 pounds more to lose, you're stuck. So a low-fat diet is not a good program for weight loss. A low-fat diet, because there's some weight loss involved, can reduce blood sugar at first. And it can reduce a need for some medications that reduce blood sugar. But it tends to stall, and often insulin resistance and blood sugar typically go up, particularly if you weigh your diet heavily in grains and other carbohydrates in place of the fat you've reduced. Metabolic markers in low-fat diets are disastrous. You'll see a drop in HDL, cholesterol, the good. You'll see a dramatic rise in triglycerides and VLDL particles that cause heart disease. You're going to see an explosion in small LDL particles. You're going to see a rise in blood sugar, fasting blood sugar, after meal blood sugars, insulin resistance, blood pressure, fatty liver. So in other words, a low-fat diet results in a whole landscape of disastrous metabolic changes. Now, one thing the low-fat diets typically do not do is result in a reduction in calories. But here's a real kicker. If you cut calories, as many people often do, thinking it's a good thing to do, and you combine it with a low-fat diet, now you have a situation that is explosively causing gallstones. So it's bad to cut calories, it's bad to cut fat. Do both, cut calories and fat, and you are setting yourself up for lots of gallstones and probably surgery to remove those stones. And in a low-fat diet, what happens to cardiovascular risk markers? Well, my colleagues thought that reducing bad LDL cholesterol is a good thing. That does happen in most low-fat diets. But when we look beneath the surface at the real markers for heart disease, such as we see in an NMR lipoprotein panel, you're going to see that a low-fat diet is once again a disaster. It increases small LDL particles that become very glycation and oxidation prone. It causes a rise in VLDL and triglycerides. It worsens insulin resistance and inflammatory markers. So a low-fat diet typically worsens most, if not all, the markers that are risk factors for cardiovascular disease. So I think low-fat diet is probably the worst choice you could possibly make. A little upfront benefit, but long-term disaster. How about a Mediterranean diet? You often hear that a Mediterranean diet is the ideal diet for cardiovascular risk reduction, right? Well, let's first talk about a very simple sequence in logic. If you understand this basic line of logic, you will see past so many of the fictions that are popular in nutrition. So, many nutritionists, many dietitians, many doctors think that if you replace something bad with something less bad, and there's an apparent benefit, a whole bunch of the less bad thing must therefore be good. Well, let's take unfiltered full-tar cigarettes that cause lung cancer and heart disease, right? You replace them with filtered low-tar cigarettes. And what if there's a modest reduction in lung cancer and coronary disease and death? Well, by the logic of nutrition, you would say you should smoke a lot of filtered low-tar cigarettes. Less bad must therefore be good. I think you see that that's ridiculous, right? So we can't follow that kind of logic. But this is why, for instance, you'll see in dietary circles, white flour products, bad, right? Lots of type 2 diabetes, autoimmune diseases, weight gain, etc. Replace it with whole grains, There's an apparent reduction in weight gain, not weight loss, a reduction in weight gain. There's a reduction, not relief from type 2 diabetes. There's a reduction, cardiovascular, not elimination of, but just a reduction. The less bad must therefore be good. Do you see the flaw in logic there? So if we take a standard American diet of fast food, sugary soft drinks, hydrogenated fats, lots of processed foods, saran wrap, cellophane wrap, microwavable garbage foods, and replace it with a whole food, more natural type diet rich in olive oil and has fish and tends to have far less processed foods, a so-called Mediterranean diet as used to be practiced in Italy, Greece, Crete, etc. And there's an apparent benefit. Authorities then say the Mediterranean diet must therefore be the ideal diet. Well, you can see that. They can say there's improvement or there's less adverse outcome on a Mediterranean diet, but you cannot conclude that it is the ideal diet, because I think there are many improvements we could make on the Mediterranean diet. Now, how does the Mediterranean diet stack up against those 5 requirements that we talked about in the beginning? Well, does it achieve weight loss? Well, it seems not generate as much weight gain. It's not been really examined in the setting of losing weight purposefully. It's only been looked at in, is it less weight gaining than other, and it seems to have that effect. Does it reduce blood sugar? Probably. Once again, it's not been looked at as in a therapeutic way very well, but people who follow a Mediterranean diet naturally tend to have less diabetes by about 50%. So it seems to have some power there. How about metabolic markers? Not enough evidence. But because Mediterranean diets still include such things as grains, there's probably still a fair amount of small LDL particles, triglycerides, and at least some fatty liver. So it's less bad, yes, but it may not be ideal with regard to these metabolic markers. A Mediterranean diet does not have a requirement for reduced calories, so that's good. And Mediterranean diet has a mixed effect on various cardiovascular markers because it does not restrict such things as grains, and there are some sugary foods involved. You can still have such things as some fatty liver, high triglycerides, VLDL, insulin resistance. It's not as bad as on a low-fat diet. It's not as bad as on a standard American diet, but it may not necessarily be ideal. If we want to get towards what I think is closest to the ideal, it's a low-carb diet. Now, you can call it by any number of names. You might call it Atkins, South Beach, keto, ketogenic diet, paleo, my programs, wheat belly, Undoctored. They all vary, but there's a lot of overlap among all those programs. But how does a low-carb diet stack up? Let's accept we really mean a real low-carb diet that is typically, depending on who you talk to, I say no more than 15 grams net carbs per meal. Others say no more than 50 grams net carbs per day. There's other varying rules to follow. But let's just lump them all together. How do they stack up with regard to those 5 rules? Do low-carb diets achieve weight loss? Yes. Far more so than a low-fat diet and virtually all other diets, low-carb diets get an A+ for weight loss reduction. How about reduction in blood sugar? Well, yes. On a low-carb diet, you've cut back dramatically the foods that raise blood sugar and cause insulin resistance. So you can expect dramatic reductions in blood sugar, so much so, as we talked about, that people with diabetes who take insulin or oral drugs or other drugs need to slash the doses dramatically even before they start the program, so there's no hypoglycemia. How does a low-carb diet stack up with regards to metabolic markers? It comes up A+, because there's a rise in HDL. HDL becomes larger and more protective. Triglycerides plummet. VLDL particles plummet. Insulin resistance drops. Fatty liver at least begins a major retreat. Blood pressure drops, inflammatory markers drop. So compared to other diets, a low-carb diet comes up at the top for correction of those metabolic markers. With regard to cutting calories, most people on low-carb diets do not limit calories because you're already on a program that achieves magnificent weight loss for most people, so there is no need to run the risks and the destructive effects of cutting calories. And then lastly, people say, oh, on a low-carb diet, you'll increase cholesterol. Who cares? Cholesterol, once again, does not cause heart disease. Metabolic distortions, like small LDL particles, fatty liver, Insulin resistance, something called endothelial dysfunction, that's what causes heart disease. It has nothing to do with LDL cholesterol, it has nothing to do with statin cholesterol drugs, has nothing to do with high saturated fat intake. So when you go on a low-carb diet, you have dramatically improved all the factors that lead to cardiovascular disease. That rise in HDL, larger, more protective HDL. Reduction or elimination of the small LDL particles that last much longer than the large LDL particles, are adherent to the arterial wall, provoke inflammation in the arterial wall. You reduce VLDL, triglycerides, fatty liver, insulin resistance, liver insulin resistance, you reduce blood pressure. So on a low-carb diet, you can expect an across-the-board dramatic improvement in weight, blood sugar, insulin resistance, various metabolic and cardiovascular risks, and you don't have to cut calories and run all the risks of doing that. Now, I can tell you, you can do even better as a type 2 diabetic or type 1 diabetic by not just relying on diet, but taking additional steps to address all the factors that have given you resistance to insulin. That is the factor, the process that allowed diabetes to emerge in the first place, type 2 diabetes. So what is that? Vitamin D. We supplement vitamin D combined with sun exposure you can manage and try to achieve a 25 hydroxy vitamin D blood level of 60 to 70 nanograms per milliliter, typically achieved with 5,000 to 6,000 units of an oil-based gel cap per day. That alone, huge benefit in reversing insulin resistance. We supplement omega-3 fatty acids from fish oil. That adds the effect. We try to get around 3,600 milligrams of EPA and DHA per day from fish oil divided in 2 doses. We make sure you're getting iodine because any measure of thyroid dysfunction, hypothyroidism, contributes to insulin resistance. And just getting iodine, 350 to 500 micrograms per day is what we use from potassium iodide drops or from kelp tablets, very inexpensive, does the trick. Supplementing magnesium, because we all drink filtered water. We have to, right? Water's tainted nowadays. So either the city or you have to filter your water, but water filtration is hugely effective for removing all magnesium. And lack of magnesium amplifies insulin resistance and allows higher blood sugar. So we supplement magnesium, 400, 500 milligrams per day, that range, from magnesium malate, magnesium glycinate, magnesium chelate, magnesium citrate, the better absorbed forms of magnesium, or best of all, my recipe for magnesium water, which you'll find in my Wheat Belly blog, my Undoctored blog, all my Wheat Belly books, my Undoctored books. Very easy, unflavored milk of magnesia reacted with carbonated water from seltzer or something similar, and you get water and magnesium bicarbonate, the best form of magnesium you can get with the greatest absorption. See those discussions for how to dose it. And then lastly, we address the ubiquitous problem of disrupted bowel flora, dysbiosis. This is not a small issue. This is a national, international epidemic. And that's the toughest part of it all. We start trying to restore a healthy microbiome with a high-potency multi-species probiotic, at least a dozen species, if not more, counts of at least 50 billion CFUs or bacterial counts. We include a lot of fermented foods like real yogurt, not garbage from the grocery store, but real fermented yogurt, kefirs, kombucha, fermented veggies. If you want to know how to do that, you can get starting advice on how to get started on fermenting veggies and other foods in all my books. And there's also other resources that go into much greater detail. You can also buy them now, a lot in the store. Fermented sauerkraut, fermented pickles, fermented other veggies. Lots of choices are coming out in the supermarkets nowadays. And then lastly, prebiotic fibers. We aim for 20 grams of prebiotic fiber. Not 20 grams of fiber, 20 grams of prebiotic fiber. See my Wheat Belly blog and all my books for a listing, a full listing of all the sources like raw white potatoes, green unripe bananas, inulin powder, acacia fiber, small serving of legumes, chickpeas, hummus, lots and lots of sources, and that's what feeds your bacteria. If you have type 2 diabetes or type 1 diabetes, you can expect huge reductions in blood sugar. So what you've done, if you're type 1, for instance, you've minimized your need for insulin. You'll find that your insulin needs are a tiny fraction of what you still need it, of course, because you've lost the capacity to make insulin, but you need far less. For a type 2, most typically, you come off the insulin. By the way, when you come off insulin as a type 2 diabetic, weight loss melts off you because insulin is the hormone of fat accumulation. When you get off this high level of insulin and you restore sensitivity to insulin, you can drop dramatic quantities of weight when you get off insulin and then off the other drugs. Now, this is great because whether you're type 2 or type 1, when you have this kind of magnificent control over both blood sugar and insulin resistance, as well as that whole landscape of metabolic markers, you have dramatically reduced or eliminated your lifetime risk of such things as colon cancer, diabetes, of course, peripheral vascular disease, coronary disease, cerebrovascular disease, dementia, other forms of cancer. In other words, all the common chronic diseases of modern people, driven by high blood sugars, insulin resistance, inflammation, okay, all that stuff reverses. And you can literally add many, many years to your life because you've eliminated all the excess risk of uncorrected blood sugars, uncorrected insulin resistance, so that you can live longer and your later days will not be plagued by dialysis, blindness, amputation, because you're either non-diabetic or at least minimally diabetic. Please join my conversations. You can subscribe to this YouTube channel below. Also join my conversations in my Wheat Belly blog, very busy place, my Undoctored blog, of course, all my Wheat Belly books, my Undoctored books. If you want the latest summary of how we do this, you'll see my entire programs summarized in my latest book, which is Wheat Belly Revised and Expanded. You'll find the entire program summarized there, all the lessons learned in the last 9 years compressed into one book, including new recipes, new success stories, and all updated strategies.